Hello, good morning. Put you up here so I can make eye contact. You guys, I wanted to give you a few pointers on how to fill out this altered mental status / stroke assignment. It's very short. As you can see, I crossed this out right here, but we did cover the altered mental status slides in the classroom. Maybe you weren't fully comprehending, so I wanted to give you guys a few pointers on what you can be typing over here. All right, so for example, I'm not using Canvas right now. I'm using CamiEdit because it's easier for the purposes of this video. But let's just say that I'm working on this like you are. By the way, this is due on the 19th at midnight. And so stroke, that's something we already covered last module. But for example, well, let's back it up. Every single condition listed below, I don't care what condition it is, you're always going to check vitals, right? You're always going to check vitals. So if you put, oh, that's way too big. Hold on. Let me do 12. So if you were to, check vitals on every single one of these, you would be correct. But of course, that's not the only thing you're going to check. And really, you should not be lazy and just cut and paste vitals because, again, we're checking other things. Now, what's included in vitals? I would put BP, that stands for blood pressure, pulse, respirations. What's pulse? That's your heartbeat, right? Respirations. You could abbreviate it like that if you want. Now, what else are we checking besides? So, like, let's say I was trying to be efficient. I could easily just cut and paste this one or duplicate it or whatever you want to say. Let's just say I did this and X out of those. Boom. Okay. Boom. There's probably an easier way to do it. Maybe tab. No, tab's not working. But if this is the only thing you put, I'm going to be not happy because there are definitely other things you need to be checking with these patients besides just cutting and pasting vitals on everything. Each type of condition has its own unique type of approach and what you're going to check, right? So, for example, we'll just jump down. I'm just showing you how easy this is, though. I don't know if it's this easy in Canvas. I'm guessing it's not that much more difficult. Now, as you can see, we have a few different medical conditions covered here. Like, for example, CVA. In case you don't remember what a CVA is, that's a code name for a stroke. It stands for cerebral vascular accident. And of course, we have cardiac, we have infection. Another, in case you forgot, what's another word for infection? Well, if it's an infection to the point where they're having altered mental status, that's not just a regular little infection. It's usually sepsis or septic shock. And like I explained yesterday to the fire EMTs, if you have a urinary tract infection in your bladder, your urinary tract is down there, right? And your brain is up here. So there's no reason why you should be confused, right? Like you don't even know your own name or you don't know what year it is because of a bladder infection, unless it's advanced to the point where it's now affecting your entire body system. Why? Because the toxins from that infection have now entered your bloodstream and circulated through your entire body, and now your body is in some way shutting down, or it's in the process of shutting down, because you are now in septic shock. We do not like that, right? We need to do something. Okay, so there's a lot of different conditions here. This one's just kind of a generic shock. All right, so what else do we check for generic shock, like regular shock symptoms? We want to check blood pressure, pulse, respirations. How about skin signs? Skin signs. How about, let me see here. What about mental status? Yes. And you know what? It's funny that we mentioned that one because that's the whole point of this homework assignment. Altered mental status. They're confused. What else could we check? SpO2. That's pulse ox, right? pulse oximetry. All right, so let's go to treatment. What things do we do for shock? Some things we can do for shock. We can give oxygen. If you want to make it shorter, you can put O2. Oops. O2. Okay. We can keep them warm, provide a blanket slash keep warm, right? And of course we can transport them to the hospital, stuff like that. Okay, so you get it. And what else? So let's go down to drugs. Okay, so drugs, what else are we going to check besides vital signs? We're going to check, what are we going to check? Pupils, yes. Pupils, definitely. Are the pupils dilated? Are they constricted? Are they unequal? They shouldn't be unequal from drugs, more than likely. But anything's possible, right? Because maybe they have drugs in their system and maybe they also have something else happening, like a stroke or a traumatic brain injury or some other thing. So I'm not saying it's not possible. Drugs and ETOH. Oh yeah, what is ETOH? Do you guys know? ETOH is a fancy abbreviation for alcohol. Alcohol. So drugs are alcohol. We're checking their pupils. We're checking their eyes. Isn't it the same thing? No, we're checking their pupils, which is that middle part, and then we're checking the entire eye. Because we're checking for redness, we're checking for the pupils themselves, and we're checking for abnormal eye activity, which is a different thing, which could be from drugs or alcohol as well. So all of that kind of stuff. Those are all assessments. I'm not typing all this because you know what? The rest is up to you. I'm not going to type everything. Otherwise, I'm doing your homework for you. All right, and then treatment, it depends on what drugs they use. Like, for example, Narcan only works on, like, narcotics. We call them opioids, narcotics. Like morphine, heroin, fentanyl, stuff like that. But if they're on like uppers, like stimulants, stuff like that, the Narcan is not going to do anything. So for those people, we're not going to give Narcan. What are we going to do to treat them? Probably restrain them because they're going to be acting crazy. Restrain them. Maybe give them oxygen if needed. Transport them safely to the hospital without getting themselves or you hurt. Things like that. All right, trauma, that's a different kind of situation. We also want to check the pupils on a trauma patient because we want to see if they're unequal, maybe traumatic brain injury, a brain bleed, something like that. And what else do we want to check on a trauma patient? We want to look for visual injuries. Like if they're altered mental status, they're confused and they're not answering any of your questions correctly, or they have repetitive questioning, and then you look and they have a big old huge like hole right here in their head. Do you think that might have something to do with why they're confused? I'm going to say yes. So check for injuries. It could maybe not the head. It could be somewhere else. Like if they have a hole in their chest, a gunshot wound, and they're confused. And you're like, well, that doesn't make sense. The brain's right here. But maybe they're not getting good oxygenation because they have a collapsed lung, or maybe their heart has been hit by a bullet or something, or shrapnel. Anyway, you get the idea. So we're going to check pupils. We're going to check vital signs. We're going to check skin signs. We're going to check, for signs of obvious trauma, life-threatening trauma, and treat life threats. I don't need to capitalize everything, huh? Etc. All right. Oh, I forgot. This should be over by treatment, right? Because treatment is over here. So we'll just cut that. Put it over here. Okay. And of course, most of our traumas are going to get some O2 and stop the bleed, which would be treating a life threat. Okay, we don't care about the little tiny things right now. If it's a major trauma, care about the really severe things that are going to kill you right away. Try to fix that, and then you can worry about all the other stuff. I have like broken pinky. I got in a really bad car accident, and I'm like, my pinky is broken, but I don't know my own name. That's a bigger problem. Who cares about my pinky right now? Forget the pinky. All right, infection. We talked about sepsis. What are we looking for in sepsis? We're looking for all the abnormal vital signs. Sepsis definitely has abnormal vital signs. Elevated heart rate, decreased blood pressure, abnormal respirations. What else? Temperature, elevated temperature because, they have a fever because of the infection. And a little bit of temp. What else could we notice? Abnormal skin signs. Not just the temperature, but the color, the moisture, or lack of moisture. Maybe their skin's dry and hot. What are we going to do? We're going to treat them aggressively with, we're going to treat them with some O2, and if we have a paramedic, we're going to start IV fluids. Definitely they need IV fluids, and they're going to need to go to the hospital quickly to get antibiotics, IV antibiotics. Sepsis can be very deadly, especially with geriatric patients, right? And, okay, let's jump down to stroke. Stroke, what are we going to do? We're going to check all the vital signs. We're going to check the mental status, and we're going to definitely be doing a stroke exam. Now, what I want to do is switch over to the other tab so I can show you the PowerPoint for the stroke exam. If I can find it. It looks like it closed. So let me do this. And if you're still watching this video, you must really care about getting your assignment done, because I know how short the attention span is nowadays. People stop watching videos after 30 seconds. But if you are still watching, congratulations. You're one of the good ones. And if the person next to you is gaming right now, I want you to slap them. I'm just kidding. Don't do it. Don't do it. But tell them, Mr. Campbell said, get to work. Look at them awkwardly and say, get to work. Okay, so go to stroke and altered mental status. We'll just make this full screen. So if you have somebody who you suspect is having a stroke, you definitely want to do a stroke exam. And that, first of all, there are two types of strokes. Called in sick today because my allergies have been crazy. Okay, two types of stroke. One is a blockage, and the other one is a bleed. So think blockage and bleed, the two B's, blockage and bleed. Which one's worse? The bleed. That one can kill you fast. They can both kill you, but one can kill you fast, and the other one can kill you kind of fast, but not as fast. Excuse me. All right, so the fancy term is hemorrhagic and ischemic. Hemorrhage means bleed, right? So hemorrhagic is the bleed. Ischemic is the blockage. So as you can see from this picture, you have right here, you have a blockage right here. See, there's no blood flow right here in this blood vessel because there's a blockage. But over here, there's an actual bleed in the brain because one of the blood vessels ruptures, basically like an aneurysm. All right, so what do we do to check for stroke? We do a stroke exam. The main one we use, back it up. We use FAST as our little acronym to remember what we're checking. We're checking face. Can they smile evenly? Or when they smile, does it look like this? That's not normal, right? So if you say smile and it looks like this, then not good. Arms. Can you hold both arms out? Can you do everything evenly? Like, can you give me 2 thumbs up? Can you grip equally on both sides? All that stuff. Everything looks good. Smile. You know what I mean? You can check the same thing on the feet. Well, don't ask him to give a thumbs up with the feet because that's cruel. No one can do that. But you can ask him to push down on your hands, like put your feet on my hands, push down. Put your hands above their feet and ask them to pull up with their toes, things like that. Make sure everything is equal. Have them repeat a sentence after you with lots of syllables and consonants to make sure they don't have slurred speech. And then timing basically means how long since the symptoms first appeared. So again, check their face, check their arms. These are all things that you can type for your assessment on stroke. And then, of course, the the arm test. See if they have hand drop, like on one side, weakness, all that stuff, slurred speech. And these are things that you need to check. If they've had any of these symptoms, but it's been less than 3 hours, there's a possibility that they could have the symptoms reversed if they get to it soon enough. There's a Cincinnati stroke exam, basically everything I just said. But let's say that you hate Cincinnati and you're like, I'm not doing that. Nope, I hate Cincinnati. Okay, fine. You know what? Then you can try the LA one. This is like the West Coast version of the stroke exam if you're like more of a West Coast person. And so this is the LA motor scale, same type of thing, but just it's technically a little bit different. All right, and a TIA is basically like a temporary stroke. We'll talk more about that later. Let's go back to the other tab so I can finish talking and wrap this up. You guys I'm skipping dementia and Alzheimer's for now, but you guys already know about hypoxia. That's a lack of oxygen. So what types of things are you going to check? Of course, you're going to check vitals, mental status, SpO2, skin signs, right? Are they cyanotic? Are they turning blue lips, blue fingertips, things like that? And, the treatment is obviously oxygen for those conditions. Now, diabetes, there's a whole slideshow on diabetes. Always going to check a blood sugar. Actually, let's back this up. Any altered mental status, you're always going to check blood sugar. Let me show you how to type that. You could, if you wanted to, you could type out the word blood sugar. Or here's an easy way to type it. Don't type BS because that's not a good abbreviation. Put BGL, blood glucose level. Okay? The blood glucose level should be between 80 and 120. If it's like really, 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 really low or really, 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 really high, then that's why that might be the reason why they're confused. Sometimes you think they're having a stroke, and then you check their blood sugar and it's like 10 or 20, and then you give them some sugar into their IV and everything goes back to normal. What does that tell you? That tells you they were not having a stroke. It was low blood sugar. Okay? Lastly, we need to talk quickly about dementia. What you need to do with dementia patients, you're going to still check all of your normal things like vital signs, skin signs, mental status, blood glucose, all that stuff. But another thing you need to check with these people is what we call their baseline mental status. And how you're going to do that. You can't ask them because they're confused. You can't be like, hi, are you confused? Like, they're confused. Of course, they're not going to be able to answer that. So what you need to do is you need to find a family member or a friend or someone that lives with them and ask them, what is their baseline? Like, are they normally confused? Are they acting according to their normal mental status? Sometimes they're always confused, so nothing has changed. But other times, yes, they're slightly confused usually, but today they're really, really confused. It's a lot worse today than it usually is. So, my battery's going to die. Okay, well, I should end this video now. But again, get this done. It's due on the 19th. And thank you for watching because my battery's about to die. If you have any questions, you can email me. Goodbye.